After 60, most heart attacks don't begin with crushing chest pain. They begin quietly, years earlier, with changes so subtle you call them normal aging. You walk a little slower. You need more recovery after simple tasks. Your feet feel cold even in a warm room. It doesn't feel urgent. It feels gradual. And that's exactly why it's dangerous. Because sometimes it's not age. It's your arteries slowly narrowing, reducing blood flow to your heart, your brain, your legs. And by the time chest pain appears, the process has often been building silently for years. Today, I'm going to show you 5 hidden circulation warning signs most people over 60 ignore, so you can recognize them early, not after a crisis forces you to. When people hear the phrase clogged arteries, they often imagine something sudden, like a pipe that gets blocked overnight. In reality, it's usually much slower than that. Clogged arteries refers to a gradual process called plaque buildup. Over many years, small deposits of cholesterol, inflammatory cells, calcium, and other materials begin to collect in the inner lining of the blood vessel walls. This doesn't happen in a week. It doesn't even happen in a year. It develops quietly, often over decades. As this plaque slowly thickens, it narrows the channel through which blood flows. Think of it less like a sudden blockage and more like a roadway that becomes progressively tighter. At first, traffic moves normally, but as the space decreases, movement becomes less efficient. And when blood flow becomes less efficient, oxygen delivery begins to suffer. Every tissue in your body, your brain, your muscles, your kidneys, even your skin, depends on steady oxygen-rich blood. When arteries narrow, that delivery system becomes strained. You may not feel pain, but your body may start adapting in subtle ways. At the same time, your heart has to work harder. If the pathway is tighter, the pump must generate more force to push blood forward. Over years, that increased strain can contribute to fatigue of the heart muscle itself. What makes this process particularly important after 60 is that it rarely announces itself loudly. It doesn't usually begin with dramatic chest pain. It begins quietly, with reduced reserve, less flexibility in the vessels, and small changes in how your body responds to exertion. And this is why many people mistake early signs for just getting older. Now that we understand what clogged arteries truly means, a slow narrowing that limits oxygen and increases strain, let's talk about how that narrowing can show up in ways most people don't immediately recognize.
As we move past 60, the conversation shifts from if arteries have been exposed to stress to how long they've been exposed. Risk increases after 60 largely because time compounds everything. First, there's longer exposure to cholesterol circulating in the bloodstream. Even moderately elevated cholesterol levels, when present for 30 or 40 years, can gradually embed into the vessel wall. It's not usually one high reading that causes trouble. It's decades of quiet accumulation. Second, high blood pressure becomes more common with age. Elevated pressure doesn't just strain the heart, it also creates microscopic stress on the inner lining of arteries. Over time, that repeated pressure can damage the delicate endothelial layer, making it easier for plaque to form and harder for vessels to stay flexible. That brings us to natural stiffening. Arteries are not rigid tubes. When we're younger, they expand and recoil easily with each heartbeat, but with aging, even in healthy individuals, the vessel walls gradually lose elasticity. Collagen increases, elastin decreases. The result is a system that is less forgiving. Stiffer arteries mean higher pressure peaks and greater workload for the heart. Reduced physical activity also plays a role. After retirement, or simply due to joint discomfort or lower energy, many people move less. Movement is one of the body's natural circulation stimulators. Regular activity helps maintain vessel flexibility and encourage healthy blood flow. Without it, circulation becomes less efficient over time. None of these changes happen overnight. They layer on one another, year after year. That is why two people with similar cholesterol levels may have very different outcomes at 65 versus 45. The difference is duration. The body has had more time to accumulate damage, adapt poorly, and narrow its margins of safety. And when margins narrow, symptoms often become subtle rather than dramatic, which is why the next signs we're going to discuss are not the ones most people expect. One of the reasons clogged arteries are so often missed in their early stages is not because the body fails suddenly, but because it adapts remarkably well. Early symptoms develop gradually. There is no clear starting day, no dramatic moment. Instead, small changes blend into daily life. You may not notice a difference from last month, but compared to 5 years ago, your capacity may be very different. Another reason they're easy to ignore is that they rarely begin with sharp pain. We've been conditioned to associate heart problems with crushing chest discomfort, but reduced circulation shows up as subtle limitation, not agony. Mild tightness, slight breathlessness, a sense of heaviness. These sensations don't demand emergency attention, they whisper rather than shout. The body also compensates. If blood flow becomes slightly restricted, smaller vessels may widen to help reroute circulation. The heart may pump a little harder. Muscles may use oxygen more efficiently. For a time, this compensation keeps everything functioning. You continue your routine, you tell yourself you're fine. And then there's the gradual reduction in activity. If walking uphill feels harder, you may unconsciously avoid hills. If carrying groceries feels tiring, you carry fewer at a time. If stairs leave you winded, you take them more slowly. These adjustments feel logical, even wise, but they can mask the underlying problem. The body adjusts before it complains. By the time clear symptoms appear, the narrowing has often progressed significantly. That's why paying attention to subtle, persistent shifts in stamina, temperature sensitivity, or recovery time becomes so important after 60. Because what feels like normal aging may sometimes be your circulation quietly losing efficiency. And the first hidden sign often appears where people least expect it.
One of the earliest and most overlooked signs of clogged arteries doesn't happen in your chest. It happens in your legs. Many people begin to notice a strange tightness in their calves while walking. At first, it seems minor. Maybe it starts after walking a few minutes. Maybe it happens when climbing stairs or walking uphill. The muscles begin to feel heavy, tight, or slightly painful. Most people assume it's just aging. They think, I'm getting older, my muscles aren't as strong as they used to be. But the pattern tells a deeper story. You may find yourself needing to stop more often. You pause for a moment, rest, and the discomfort fades. Then, when you start walking again, the tightness returns. This cycle repeats itself: discomfort with activity, relief with rest. This is not how normal muscle aging behaves. Healthy muscles may feel tired, but they don't repeatedly send distress signals after predictable distances. When discomfort appears consistently during movement and disappears with rest, it often points to a circulation problem, not a muscle problem. This condition is commonly associated with peripheral artery disease, where arteries supplying the legs become narrowed due to plaque buildup. As a result, the muscles don't receive enough oxygen-rich blood during activity. When you walk, your muscles demand more oxygen, but narrowed arteries cannot deliver enough. The muscle begins to suffer from temporary oxygen deprivation. This creates the sensation of tightness, cramping, or heaviness. The moment you stop walking, the demand drops, blood flow catches up, the discomfort fades. This pattern is one of the clearest early warning signs of circulation limitation. It's not just discomfort, it's your muscles revealing that your arteries may no longer be delivering the blood flow they once did. What makes these leg symptoms so important is not just the discomfort itself, it's what they reveal about your entire cardiovascular system. The arteries in your legs are some of the longest and narrowest arteries in your body. Blood must travel a much greater distance to reach your calves and feet compared to your heart or brain. Because of this length and size, even small amounts of plaque buildup can begin to restrict blood flow. Think of it like a long, narrow pipe. It doesn't take much buildup along the walls before flow becomes limited. This is why the leg arteries often show signs of narrowing earlier than the arteries supplying the heart. In many cases, circulation problems in the legs are the first visible warning sign of a much larger silent process happening throughout the body. Plaque doesn't usually form in just one place. It develops systemically, affecting multiple arteries over time, including those that supply the heart and brain. This is why doctors consider leg circulation symptoms a potential early indicator of widespread arterial disease, often linked to conditions like atherosclerosis. When plaque begins narrowing arteries, the legs may show symptoms first simply because they are the farthest from the heart and require strong, consistent blood flow to function properly. If blood struggles to reach the legs, it may be struggling to reach other vital organs. This is why leg discomfort during walking is not just a mobility issue. It can be an early cardiovascular signal, a warning that plaque may already be affecting your circulation, even if you feel completely normal otherwise. Recognizing this early gives you something incredibly valuable: time. Time to intervene, time to protect your arteries, and time to prevent more serious events like heart attacks or strokes later on. Another subtle sign that often gets dismissed as just getting older is persistently cold feet, even when the room is warm. Many people notice their toes feel cool to the touch most of the time. They may wear socks indoors, not for comfort, but because their feet never seem to warm up. Sometimes one foot feels colder than the other, which can be especially concerning. This is not simply a temperature issue, it's a circulation issue. Your blood carries heat throughout your body. Warm, oxygen-rich blood travels from your heart through arteries to reach your hands and feet. When circulation is healthy, your feet maintain a normal, stable temperature even in cooler environments. But when arteries become narrowed due to plaque buildup, less warm blood reaches these distant areas. As a result, your toes and feet begin to feel persistently cold. You may also notice changes in skin color. The skin may appear pale, slightly bluish, or less vibrant than before. This happens because oxygen levels in the tissue are lower than normal. Without adequate blood flow, the skin loses its healthy pink tone. One of the most important warning signs is asymmetry, when one foot feels colder than the other. This suggests that blood flow may be more restricted on one side, indicating uneven narrowing in the arteries. This pattern is often associated with early stages of peripheral artery disease, where circulation to the lower limbs becomes compromised. Many people assume cold feet are simply part of aging, especially after 50. But healthy aging alone does not suddenly reduce blood flow enough to change skin temperature consistently. Temperature reflects circulation quality, and when your feet remain cold, even in normal indoor conditions, it may be your body signaling that blood is no longer reaching the tissues as efficiently as it should.
One of the most overlooked signs of clogged arteries isn't pain, it's slowing down. Many people don't notice it immediately. There's no sharp discomfort, no dramatic event. Instead, the change happens gradually. Your stride becomes shorter, your pace becomes slower. You may find yourself walking behind others when you used to walk beside them. At first, it seems harmless. You may blame aging, less exercise, or simply getting older. But often, the real cause lies deeper, in your circulation. Walking is one of the most circulation-dependent activities your body performs. Every step requires oxygen-rich blood to travel from your heart through arteries to your leg muscles. When blood flow is efficient, your muscles receive the oxygen they need and movement feels smooth and sustainable. But when arteries begin to narrow due to plaque buildup, blood delivery becomes less efficient. Your muscles begin to receive less oxygen than they require. As a result, fatigue appears sooner than expected. Your legs may feel heavier earlier in the walk. You may unconsciously slow your pace to reduce the demand on your muscles. Over time, you may begin avoiding longer walks altogether, not because of pain, but because of subtle exhaustion and discomfort.
This change often happens so gradually that people adapt without realizing it. They shorten their routes, they rest more often, they adjust their lifestyle around declining circulation. Research from organizations like the American Heart Association has shown that walking speed is strongly linked to cardiovascular health. Slower walking speed can reflect reduced efficiency of the heart and blood vessels in delivering oxygen throughout the body. It's not just about fitness, it's about blood flow. When arteries are healthy, muscles respond quickly and efficiently, but when circulation is compromised, even slightly, your body begins conserving energy to protect itself. A decline in walking speed may seem like a small change, but it can be one of the earliest functional signs that your circulation is no longer working at full capacity. Another warning sign that often goes unnoticed appears when your body tries to heal. Small cuts, scratches, or minor wounds on your feet or legs begin taking longer than usual to recover. What once healed within days may now take weeks. Sometimes the skin remains red, irritated, or fragile long after the injury occurred. This is not simply a skin issue, it is a circulation issue. Healing is one of the most oxygen-dependent processes in your body. Every time your skin is injured, your body sends oxygen, nutrients, immune cells, and repair proteins through your bloodstream to the damaged area. These components rebuild tissue, fight infection, and restore the skin's protective barrier. But when blood flow is reduced, this repair system slows down. Less oxygen reaches the wound, fewer repair cells arrive. Tissue regeneration becomes delayed. As a result, wounds linger longer than normal. You may also notice that the skin on your lower legs begins to look different. It may appear thinner, smoother, or slightly shiny. Hair growth may slow down or stop entirely. This happens because hair follicles and skin cells require steady oxygen supply to remain healthy. When circulation declines, the body prioritizes vital organs like the heart and brain. The skin and hair receive less support. Persistent redness can also occur. This reflects inflammation and incomplete healing as the body struggles to fully repair damaged tissue. This pattern is commonly seen in people with early or progressing peripheral artery disease, where narrowed arteries limit blood delivery to the lower limbs. Many people dismiss slow healing as a normal part of aging, but healthy circulation allows efficient repair at any age. When healing slows noticeably, it is often a signal that your oxygen delivery, the foundation of tissue repair, is no longer reaching optimal levels. Your skin is revealing what your arteries may be hiding. The fifth warning sign often feels small, subtle, and easy to ignore: a tingling sensation in your toes. Many people describe it as pins and needles. Others notice a mild burning feeling or brief episodes of numbness that come and go. It may happen while sitting, while lying in bed, or even when you're doing nothing at all. At first, it seems harmless. You may shift your foot, walk around, and the sensation fades, so you dismiss it. But these sensations are not random. Your nerves are among the most oxygen-sensitive structures in your body. They rely on a steady, uninterrupted supply of oxygen and nutrients delivered through tiny blood vessels. When blood flow is healthy, nerves function normally, transmitting signals clearly and consistently. But when blood flow becomes reduced, nerve tissue begins to suffer. Even small decreases in oxygen delivery can irritate nerve endings. This irritation creates abnormal signals, which your brain interprets as tingling, numbness, or burning sensations. This is often one of the earliest neurological signs of circulation impairment. It may appear before pain, before visible skin changes, before more obvious symptoms develop. These sensations commonly occur at rest or during the night because circulation naturally slows during these periods. When blood flow is already limited by narrowed arteries, the reduced nighttime circulation can make symptoms more noticeable. This pattern is frequently associated with reduced peripheral circulation, often linked to early stages of peripheral artery disease.
Many people assume tingling is caused by temporary pressure on a nerve, and sometimes it is. But when it happens repeatedly without a clear cause, it may be a signal that your nerves are not receiving the oxygen they need. Your nerves are highly sensitive messengers, and when circulation begins to decline, they are often the first to speak.
There is one important warning sign that many men over 60 experience, but very few recognize as a circulation issue: gradual changes in erectile function. It often begins subtly: reduced firmness, less consistency, slower response. Many men assume this is simply a normal part of aging. They accept it quietly, believing it's an unavoidable hormonal change. But in many cases, the underlying cause is not age alone, it's blood flow. An erection is fundamentally a vascular event. It depends on healthy arteries delivering a strong, consistent supply of blood. When circulation is efficient, blood flows easily into the penile tissue, creating firmness and stability. But when arteries begin to narrow due to plaque buildup, blood flow becomes restricted. The effect may appear here earlier than anywhere else in the body. This is because the penile arteries are much smaller than the coronary arteries that supply the heart. Even a small amount of plaque buildup can significantly reduce blood flow in these narrow vessels. Larger arteries may still function adequately, but smaller arteries show symptoms sooner. This is why many cardiovascular specialists consider erectile dysfunction a potential early warning sign of systemic circulation problems, often related to atherosclerosis. In fact, for some men, erectile changes appear years before any symptoms of heart disease become obvious. The body reveals circulation problems first in the smallest, most sensitive vessels. What makes this sign especially important is that it provides an early window of opportunity. It allows time to identify and address vascular health before more serious events like heart attacks or strokes occur. It's not simply about aging, it's about circulation. And recognizing this early can help protect not only quality of life, but life itself. One of the biggest misconceptions about clogged arteries is that chest pain is an early warning sign. In reality, chest pain or angina is often a late sign of significant arterial disease. Here's why. Your heart is remarkably resilient. For years, it can compensate for narrowing arteries by increasing efficiency and using existing blood vessels more effectively. Over time, the body may even develop collateral circulation, tiny new blood vessels that bypass partially blocked arteries to maintain blood flow to the heart muscle. Because of these adaptations, the heart can continue functioning well as plaque slowly builds up. Symptoms like chest discomfort, pressure, or pain often don't appear until the arteries are significantly narrowed, sometimes by 70% or more. This means that by the time chest pain shows up, the disease may already be advanced. Relying solely on chest discomfort as a warning sign can be dangerous because serious cardiovascular issues may be silently progressing long before you feel anything. Early indicators like the leg discomfort, cold feet, reduced walking speed, slow healing, tingling toes, and gradual erectile changes we discussed often appear years before chest pain. Paying attention to these subtle signs gives you a crucial window to act and protect your heart before more serious events occur.
After 60, certain people face a much higher risk of clogged arteries, and it's often a combination of factors that multiplies the danger. High blood pressure, for example, constantly strains artery walls. Over decades, this stress accelerates plaque buildup and narrows vessels. High cholesterol contributes to the very substance of plaque, creating deposits that can gradually obstruct blood flow. Diabetes adds another layer of risk by damaging blood vessels and reducing their ability to deliver oxygen efficiently. A history of smoking is also critical. Even if you quit years ago, prior exposure leaves lasting damage to the lining of your arteries, making them more prone to plaque and blockages. Family history matters too. Genetics influence how your arteries respond to stress, cholesterol, and inflammation. If close relatives experienced heart attacks or strokes, your risk is inherently higher. A sedentary lifestyle compounds all of these factors. When circulation is weak and muscles are underused, blood flow slows, arterial stiffness increases, and plaque formation accelerates. Individually, each of these risk factors is concerning. Together, they multiply the danger. After 60, being aware of your personal risk profile is essential because early recognition can give you the time and opportunity to protect your arteries before serious events occur. One of the most powerful tools in preventing serious cardiovascular events is proactive monitoring. Waiting for obvious symptoms like chest pain can be too late. Instead, you can take steps now to assess your circulation and detect issues early. Start with regular blood pressure checks. Blood pressure isn't static, it fluctuates throughout the day and night. Consistently elevated readings, especially if untreated, can silently damage arteries over time. Monitoring allows you and your doctor to intervene before damage becomes severe. Next, get a lipid profile. Knowing your cholesterol and triglyceride levels helps you understand your risk for plaque buildup. High LDL cholesterol and low HDL cholesterol are major contributors to arterial narrowing and early vascular disease. Ask your doctor about ankle brachial index screening. This simple test compares blood pressure in your ankle to your arm, revealing circulation problems in the legs that may precede heart symptoms. It's especially useful for detecting early peripheral artery disease. Pay attention to walking endurance. Track how far you can walk without discomfort or fatigue. A decrease over time may indicate reduced blood flow to the legs and signals the need for further evaluation. Finally, notice consistent physical changes. Cold feet, slow healing wounds, tingling, or even erectile changes. These subtle cues often appear long before obvious heart symptoms and can serve as early warning signs. The key is awareness. By actively monitoring these factors, you gain the opportunity to take early, targeted action, protecting your arteries, your heart, and your long-term health before problems escalate. Protecting your arteries isn't about extreme exercise or strict diets. It's about consistent, sustainable habits that support circulation and overall cardiovascular health. Daily walking is one of the simplest and most effective ways to keep blood moving, improve oxygen delivery, and strengthen the heart. Even a 20 to 30-minute brisk walk can make a huge difference over time. Light strength training helps maintain muscle mass, which supports circulation and keeps your metabolism active. Strong muscles also help your body use oxygen more efficiently during daily activities. Your diet plays a major role. Focus on fiber-rich, balanced meals. Plenty of vegetables, fruits, whole grains, lean proteins, and healthy fats. Reducing processed foods and excess salt supports healthy blood pressure and prevents plaque buildup. Avoid prolonged sitting. Even moderate activity breaks, like standing or walking a few minutes every hour, keep blood circulating and prevent stagnation that contributes to arterial stress. Maintaining a healthy weight reduces strain on the heart and arteries, while staying socially and physically active supports both mental and cardiovascular health. Stress, isolation, and inactivity can indirectly accelerate vascular aging. The key is consistency over intensity. Small daily actions compound over weeks, months, and years, strengthening your arteries, improving circulation, and reducing the risk of serious cardiovascular events. It's not about perfection, it's about creating routines your body can rely on every day.
After 60, health isn't just about avoiding disease, it's about maintaining independence and quality of life. Good circulation underpins every aspect of daily functioning. When your arteries are healthy and blood flows efficiently, you stay mobile, able to walk, climb stairs, and move without undue fatigue. You reduce the risk of falls or complications that can lead to hospitalization. Strong circulation also supports muscle strength, tissue repair, and energy levels. This means you can continue daily activities without constant exhaustion or discomfort. Ultimately, protecting your arteries is about protecting independence. Healthy circulation allows you to make your own choices, stay active, and enjoy life without being constrained by mobility limitations or preventable cardiovascular events. In other words, when you prioritize circulation and vascular health, you're not just preventing disease, you're preserving the freedom to live life on your terms. Aging naturally changes the body, but clogged arteries should never be dismissed as just getting older. Your body sends quiet signals long before a major cardiovascular event occurs. Subtle hints like leg discomfort, cold feet, slow healing, tingling toes, or gradual erectile changes. These are not minor annoyances, they are early warnings from your circulation. The earlier you notice them, the more control you maintain over your health. Early recognition allows interventions, lifestyle adjustments, medical evaluations, and proactive monitoring that can prevent serious complications. After 60, protecting your circulation isn't just about avoiding disease, it's about protecting your mobility, strength, independence, and quality of life. Pay attention, act early, because the small changes you make today can safeguard your health and preserve your future. Before you go, make sure to hit that subscribe button and tap the notification bell so you never miss crucial health tips like these. If this video helped you understand the hidden signs of clogged arteries, like and comment below. Tell us which sign you've noticed or which change you're going to implement first. Sharing this could literally help protect your heart and circulation tomorrow. Don't wait. Join our community and stay informed for a healthier, safer future.